Welcome to The Explainer. Today we're jumping right into a medical mystery that starts with something incredibly common, a simple cut. But what happens when that cut just will not heal? Well, as we're about to see, it can be a silent alarm for a much, much bigger problem.
It's such a simple thing to say, right? A patient comes in, points to a little wound, and just says, "This cut won't heal." You might even brush it off at first. But in medicine, those 5 words can be the very first whisper of a much louder storm on the horizon.
And that's the thing, isn't it? The smallest, most insignificant clue can be the key that unlocks a life-changing diagnosis. So let's do it. Let's open the case file.
Okay, so let's meet our patient. Now, on the surface, this whole thing seems pretty straightforward, but as always, the real story is hidden in the details.
So here's the rundown. Our patient is a 55-year-old man. The main complaint? A wound on his foot that's been there for 3 weeks and is going nowhere. But here's where it gets interesting. It's not just the wound. He's also incredibly thirsty, he's going to the bathroom all the time, he's exhausted, and he's losing weight. And the final, critical piece of the puzzle? He's never been diagnosed with diabetes before. You put all that together, and that's a massive red flag.
All of those symptoms are just classic signs, textbook even. But how on earth do they connect to a simple cut on his foot? And this brings us right to the core scientific question of this whole case.
I mean, really think about it. Why would a condition that's all about blood sugar have such a huge, dramatic effect on your body's ability to just fix itself? Well, it turns out high blood sugar launches a full-on, multi-pronged attack against the entire healing process.
It all breaks down into 4 main culprits. First, you've got terrible blood supply. Diabetes wrecks your blood vessels, which basically starves the wound of all the oxygen and nutrients it needs to heal. Second, nerve damage, or neuropathy. This means our patient might not have even felt the injury when it happened, so it just got worse and worse. Third, a weakened immune system. High blood sugar literally makes your body's defenses weaker, so it can't fight off bacteria. And finally, tissue repair just slows to a crawl. The stuff your body uses to rebuild, like collagen, just isn't getting made fast enough. It is the absolute perfect storm for a wound that just won't heal.
So that's the science. But how does a doctor actually confirm all this in the clinic? Well, the investigation always starts with 2 fundamental steps: digging into the patient's history and doing a thorough physical exam.
Yeah, before any fancy tests get run, the most powerful diagnostic tool a doctor has is just talking to the patient. It's all about asking the right questions. The doctor's going to dig deep here. How long has this wound really been there? Has this ever happened before? Then they'll move on to risk factors. Does he smoke? What about his weight and blood pressure? Does diabetes run in the family? And of course, they'll circle back and confirm all those classic symptoms we saw earlier. Every single answer adds another crucial piece to the puzzle.
All right, after all the talking, it's time to actually look. The physical exam is where we find the objective, hard evidence to back up all the clues we just gathered.
The focus is squarely on that foot. The doctor checks out the wound itself. How big is it? How deep? Are there any signs of a really serious infection? Next, they'll check the pulses in the foot to see how good that blood supply is. And finally, they'll run some simple tests for nerve damage. Can the patient feel a light touch or vibration? This whole checklist is directly looking for the telltale damage that diabetes can cause.
Okay, so at this point, the history and the exam are pointing a giant, flashing arrow right at one diagnosis. But you can't be pretty sure in medicine. You need hard data, so it's time to call in the lab.
These are the tests that are gonna solve the case. The blood sugar tests, especially the HbA1c, which gives you like a 3-month average, will nail down the diabetes diagnosis. A quick swab from the wound can tell us exactly which bacteria is causing the infection, so we can hit it with the right antibiotics. An X-ray is absolutely critical to make sure the infection hasn't gotten into the bone, which is a really serious complication. And finally, some baseline labs just to check for any other related damage.
So, the diagnosis is confirmed. Now, the mission changes completely. We're shifting from investigation to action. And this isn't just about healing a foot. It's about creating a comprehensive plan to manage a lifelong condition. The treatment is really a 3-part strategy. First, you attack the immediate problem. You clean the wound, get rid of any dead tissue, dress it properly, and get those antibiotics started. Second, and this is the most important part, you get the diabetes under control. Diet, exercise, medication. This is the only way you fix the root cause. And third, you prevent this from ever happening again. That means education about checking your feet every day and wearing the right shoes.
And it's so important to understand that this is not a one-person job.
Healing a wound like this takes a whole team. You've got the diabetes team managing the blood sugar, you've got a podiatrist who is an expert in foot care, and sometimes, if the infection is really bad, you'll need a surgeon to step in. Healing, in this case, is a team sport.
So, we've followed all the clues, we've made the diagnosis, and we've laid out the treatment plan. So what's the single most important message you should take away from this entire case?
After all that complexity, it really boils down to one simple, powerful idea that absolutely everyone should know.
And here it is. A cut that won't heal is so much more than just an annoyance. It could be your body's early warning system going off. Recognizing that and getting help can lead to a diagnosis years earlier, preventing all sorts of complications and, honestly, maybe even saving a limb. It is a clue that you should never, ever ignore.
And that leaves us with one final thought, doesn't it? Our bodies are constantly communicating with us. This case was all about a wound, but it really makes you wonder, what other silent signs, what other subtle signals could we be missing? Thanks for joining us for this explainer.